Hey, it's Melanie White here on the Sage Women's podcast, and I'm really excited to be interviewing one of our co-founders, Dr. David Lester. David, welcome to the podcast.
Thanks very much, Mel. It's fun being here. I'll just give a quick introduction to myself
Sure.
and just the awareness of women's health. And I've been in healthcare for 35 years now, and primarily in the US, and worked in FDA and in big pharma and a lot of development of new products and medical devices, startups, etc. But pretty much all in the healthcare space. Whereas later in my career, I got more interested in health and wellness because healthcare really tends to deal with people that already have a disease. And the issue of prevention and being able to get there earlier is, I think, something that's very important, but it's something that healthcare can't do because it's just making too much money focusing on disease. But what was clear to me is, even when I was at the FDA in the 90s, it was very clear that, and I've always been innovation-minded, but I always felt that, why don't we do clinical studies? Why don't we include women? Why don't we include children? Because we're approving these drugs based on what we're doing in men. And even back then, which is still, science has evolved, I was pretty much aware, and I was pretty vocal about the fact that it's not going to be the same. I mean, I was aware in those early days of this concept, people talk about precision medicine, that everyone's different. But if you go to categories, men and women are very different. We made up very different DNA and very different chemistry and very different physiology and very different just total systems. So it was always something that bothered me. And I'm sort of very excited now that I've got the opportunity to work with Sage and a couple of other companies that are really focusing on women, because there's a lot of good things in healthcare, a lot of bad things, but the way that the diligence they do is, I find, what's lacking in health and wellness. And I think that's part of the reason why I was very excited when we got together with Mel and then with Nick. And I got to admit, it was because of me, I brought us all together, that I had the vision that we could do something that really would be what I like to call evidence-based. It's focused on evidence, not, and that's what's lacking. I think Sage we'll be focusing on doing that, continuing with that mantra.
Yeah, and I like the fact that you have that experience in many areas of healthcare and as well as health and wellness, but also seeing that gap that women haven't actually been included in the research and the trials and all of those things. And that skews perhaps what we know about efficacy of things.
Well, and I think the other thing is, it's very key that the way we do it, we don't just take the template that was used for males. We need to create new templates that are specific for women, which means they have to be driven by women. And so there's absolutely no way that I would start up a women's health company and be the CEO. It would be an absolute sham if I was to do it. It has to be driven by people that actually live and experience it. I think that's what we've got, and that's what we're building on. Even the other couple of companies, I've made that very clear with them. The males don't have that perception of what women's health is. They don't understand it. They don't know it.
Yeah, it's pretty hard without lived experience to really get a grip of what somebody goes through. Absolutely.
Totally. And, even it's the same with my experience. I've worked in a lot of different sectors in healthcare. My unique value is the fact I've worked in them and lived in them. So I know how they think. And being able to know how they think means that you can then come up with better ways of working with it, providing solutions. This is really what's critical. And I think Sage, we've got a good core team, and the women that you brought on board, Melanie, is just unbelievable. I mean, as I said, to me, it's very humbling. I feel like an absolute moron when these women start discussing things, because it's just a space that I don't know anything about.
Yeah, we've got such an amazing team, and I'll give you the kudos for bringing us together in the first place. But I do want to talk to you today about a man's perspective on menopause, and I'd love to kind of unpack that a bit with you.
Yes, I mean, if we just look at initially, we look at our perception of women going through menopause. I'm older. My first wife went through it, was beginning to go through it. We got divorced. My second wife was finishing up with it. But all we knew about this is 10, 15 years ago. All you heard about as male were hot flushes and some of these stuff. You didn't really get much information. You didn't understand. There's no way as a male you could appreciate what a woman was going through. And then when you consider on top of that, they're the ones that are actually keeping the household going and all this. absolutely no way that there was any information available, easily available. It was there if you really had the time to really go and dig in. But to find that information that would help you to deal with it, and in a way that actually would help you to understand, because again, because the male has different emotions than females, if a woman says they've got a particular mood, the male can have the same mood, but it's a very different experience. So it's just such a gap that was going on, and through my life, I'd like to think if I'd had good information, it could have been a lot better. I'm not saying that I wouldn't have got divorced, but everything could have been a lot better in terms of managing the day-to-day issues and having children as well, all this sort of thing. And again, everyone knows when you have children, you tend to focus on the children.
Yeah.
So that it means that the issue that the women's going through, or their partner's going through, and it's both sides, it's even further put behind in the background. And again, there hasn't been a simple solution providing us with the information, I think, that would help us to make that process and that experience a lot more positive.
And what were some of the lessons that you learned, David, going through menopause with ex and current wives twice? You got the beginning and the tail end. You would have had some of your own unique experiences. What were some of the things that you learned during that time?
I don't think I really understood, they're now working with Sage and working with these brilliant coaches, I've realized there's a laundry list of things that women go through. That was never presented to me. I never saw that. So you'd see certain issues that you could say, oh, that's menopause. I mean, the other thing too is when we talk about hormonal issues, so everyone would say it's just a hormone issue with women. Well, that's right, it is. But we didn't understand what that actually meant. And I think we just know so much more. There's so much, and you see it in healthcare, so much more of a focus on endocrine. Now that I think, we begin to, and if you look at me with my career, physiology is very important. I begin to understand those sorts of physiologies. If we looked at it at the time I was going through it, I thought these were just odd behaviors. But I had no clue what to assign them to. It's really only, I'd say, in the last 10 years, which I've become a lot more aware of it. And I think that's because the science is finally to catch up. I think there's more very good female scientists that are taking more of a predominant position. So there's just more visibility. It just wasn't visible. And not that it wasn't discussed. No one knew. Well, the women knew, but
there was
because they were living it.
Yeah, there was a bit of a stiff upper lip mentality amongst women too. I mean, I had no idea that my mother was going through menopause. No idea.
And look, I must say that I generally prefer working for women because I find women have more sensitivity than men. It means that they're thinking with their brains as opposed to their private parts. Their hearts and brains is what I'd say. And when I saw these women, and they're very senior positions that I got to work with. I mean, the senior person I worked with at the Food and Drug Administration, who's still there in the mid-70s, is one of the most remarkable people I've ever met, let alone women. Her ability to handle situations. I'd watch her, and people said, "Oh, she looks sort of ditzy," and so, but she was in total control of rooms and dominant people and all this sort of thing. So it was something I saw that women are capable of that men can't do. Men have got to use muscle and all this sort of thing. So all these things were messages to me saying, I say that they don't think differently, or they don't act differently, but what does that actually mean? How does it manifest itself? And I think that's the journey that I'm continue to go on. And I'm reading Danielle Dobson's book on the gender code. Fabulous. Because it's written for women. But I look there and I think, well, I never thought about this as a male. So it's, there's a lot more that's out there now that hopefully will improve the situation, because for me, it's a sort of lost cause. I mean, what am I going to go back to my ex-wife and say, sorry, I didn't realize you're going through menopause? It's meaningless now. It's well gone. But I just think it's about providing tools and choices, and good tools and choices. That's where I come to evidence-based. And now we got more science. We can come up with better tools. I think this is a very exciting time now. And as I said, to me, the key is that women's health has got to be designed for women. can't be men's health applied to women. It's not going to work.
Yeah, and we also have to include men in the conversation, because otherwise how would we ever normalize menopause and take away the stigma and embarrassment? If men don't understand what's going on now, how can men and women ever resolve relationship issues at work, at home, or elsewhere? Because all of these things come up that change you fundamentally as a person during menopause. And that means that your relationships inevitably change one way or the other.
But I think it has to come up through the education system.
Yeah.
That's where it's got to begin, right? Not that you're going through menopause, that's not the point, but this understanding of the difference between men and women. It's not just a physical thing, it's chemical, it's mental, it's so many different features. And I think that's where it has to come from, because as you know, Melanie, older men, they're done. You can't change them, right? they're too old to learn.
Yeah.
They generally are. But if for this society to change, all societies to change, or Western societies, I'd say in particular, it's about providing good tools and providing them as early as possible. I mean, as a kid, I didn't know what the word menopause, I'd never heard the word menopause. I didn't know what it was, right?
No,
Why shouldn't you know?
We're just figuring out puberty then, right? And then suddenly you get puberty in reverse almost.
But then, you think about it, as a kid or as an older child, your mother may be going through menopause, right?
Yeah.
So it's very important, I think, that those learnings are shared as early as possible. I don't think we're ready for it yet, but it's something that we have to work towards.
I agree. And part of it is also educating women, because you can, even if you think, like I thought I knew what I was going to go through, and I really had no idea when I got here. I knew it intellectually, but when you experience it and the seismic shift mentally and emotionally, my God, I wish I had known about that earlier. Nobody speaks about it. And I met a woman recently who is 47, owns her own business, lives alone and has no children. And she didn't even know what the symptoms were. She knew nothing about menopause. So she's not equipped to be able to manage that if she's struck down by adverse symptoms. How is she going to run her business?
And that's where I'd say the one justification for men, if men are to recognize it, well, if the woman doesn't understand it, how will the man understand it?
Exactly.
So I agree, it is both. And I think that's part of it. If I look back when my first wife was going through it, I remember talking about hot flushes, and her friends talked about hot flushes, but that was it. No one talked about the impact on working. No one talked about the mental stress, the depression. No one ever talked about it in those days. It was just hot flushes, and menopause seemed to be, that was the correlation.
Yeah.
Hot flashes, I should. And I mean, it's just astonishing, but that's how simple women's health was 20 years ago.
And so, David, what do you think is possible if we are able to get the message out to people, if we are able to help them understand menopause and the symptoms and how they affect women and men? What do you think is possible if we can do that?
Look, if we can do it, we'll change society as we know it. The male-female, there's racial issues, there's all sorts of issues, but it's got to start somewhere. I think women's health is the key thing, because even in my other one of the companies I co-founded, it's in the States, it's doing quite well. We talked about improving health through diagnostics and nutrition. We talked so much, even back in this 2008, how the woman was the center of the family, even though the women were working, but everything came through the women. And I think that's why, as a starting point, it's about changing family behaviors. That's the biggest thing that you're going to get out of it, is that everyone in the family is going to appreciate this, not just the husband and the wife, but the children, the mother, the niece, all that will understand. When a woman says, I'm going through this, everyone understands the consequences of that. Yeah. That allows us then to better deal with it. Look, one thing is, I admit, is recognizing how to, it's just the recognition. The other issue is how do you deal with it? So I do think this is about change management to me.
Yeah, it is.
I don't think a lot of people recognize this as an issue.
No, and change can only happen if you know that there is an issue and you understand the issue. So the understanding must come first before the change. It's the
absolutely
change. Yeah,
100%. I think that's the process we've got to go to. I think the sky's the limit. There's no limit, but The key thing in my mind is don't follow the models that are being used in healthcare.
Mm.
Follow the tools that are in healthcare. That's where the rigor goes in the tools. How they're applied is where I think things are screwed up in healthcare.
Yeah.
Where you've got a doctor who's controlling things, and there's such a history in health. You don't have it. That's the beauty we have with what we're talking about. There's no real history in how to manage this.
No.
So we're starting off with a clean slate. That's a very exciting opportunity because it means we can learn from all the negative experiences we've seen in healthcare and health and well-being and say, we're not going to do that. Now let's make sure we do it right.
Yeah, absolutely. Like figuring out or looking at the lessons learned from past and leveraging what works and avoiding what doesn't work.
That's the key thing, is avoiding failures. That's the best that we can do now. And just, again, I think with this group of women we've got, there's a lot of positive experiences there. When we put them together, that's a hell of a starting point. Mm-hmm. That's a very powerful starting point. And also a lot of failures that this team has experienced. That's what excites me. Sage is a company about people, and it's made up of people. That's the way it's got to be.
Yeah, and people with experience, people who know what works. And I think the breadth of experience is important too, not just the lived experience of menopause or working with clients with menopause, but the lived experience in other careers that infiltrate into the quality of what they do. It's so important to have that capacity.
I think we're at the beginning of a very exciting journey. I mean, I don't know how far it'll get in my lifetime, but this is a continuing process. It'll take decades to get to where it needs to be. But I think, it's always fun being in the beginning because that's where you see the bigger impacts initially. And then you need to fine tune and evolve and all this. But I think this is a very exciting time for women's health. But again, part of the problem is what scares me with a lot of this interest in women's health. We can't let it be something that's fashionable. So it's like companies that start up saying I'm in women's health. It's like saying I'm a company that does AI. So you get funding because you're in an area that we've got to be very aware of that it's about providing value, services and products and opportunities, not just about getting a lot of women to be active in this space. Yeah. That's not going to do it.
I think you're talking about really integrating some valuable tools and processes and systemizing and making it a very systematic approach.
100%. I think that's where there are men that I know that can add value to that. Right, so they can't add value to the understanding experience, but they can add value as to how can you do it? What are the sorts of tools that you can use? And I think that's where we can learn a lot. But again, as I said, it's a very exciting time.
Yeah, and I love that you mentioned the family unit because it does actually come down to that. No matter who the family member, one person's adverse experience affects everyone around them, and then relationships can break down if there's no communication. And if we can bring it down to that basic point of how do we communicate, accept, understand, and have compassion for each other, it gets rid of divisiveness. It creates a more collaborative and inclusive way of living and being, more acceptance, less. I mean, even down to the fact that you mentioned kids and education. I was speaking to someone the other day and she said that at her workplace, the young girls who are working there used to have this term of all the old menopausal women who are crabby and because they have no understanding of what that person's going through. But they collectively, these younger women were kind of giving these older women a hard time and that crazy menopause lady. So they had these nasty kind of nicknames for those women. That wouldn't be the case if they were going through something challenging. So I think the understanding, yes, for men who haven't had that experience, but also for any other age group or any other demographic that hasn't had the exposure to or understanding of menopause.
Look, I think, and you're right. And to me, it's always, it hasn't changed. The family is the nucleus, right?
Yeah.
It hasn't changed. But I think, so, there's the male equivalent of menopause, which we go through, but I don't know what the hell that was. I mean, I guess I went through it, but andropause, well, that's the term, but I don't know what it is. But I think by bringing the family as a unit, the family moving along together, it'll help the male in identifying what are those features that they personally go through. Because the problem men have is it's just, again, that they think, as I said, with the wrong parts of their body. So that they don't have that emotional sensitivity that allows them to really delve into the reality of what's going on. This is why I like, as I said, the women, these women that I met that were leaders, Pfizer, the person who was running the company, the CEO, was actually these 3 women that were unbelievable people. Was so, I had so much respect and time for them, but they were all human beings as well, and you could approach them. So that's your rare leaders. But watching them and behave, I learned so much from watching them, and it was just so different than what you'd see from males. So different, and you got to bring it together. I mean, it's if the family's a true unit, everyone needs to understand. I mean, look, to be honest, a kid going through puberty, I don't know if I'll ever understand. But I think with adults, it needs to be brought together. If you did this domestic violence, all these things would go down. We know it. All these issues would go down, they'd decline. And so it's very important how we do it. That's, I think, the key is the message I've got is we got to do it carefully, and we've got to learn. We'll make mistakes along the way, but let's try and do it, as well as it can possibly be done.
Yeah. Women-centric.
Yep, totally. It has to be 100%. What else can I tell you? Is that enough?
That's fantastic, David. Thanks so much for the chat today. Really appreciate
My pleasure.
Your point of view, the man's point of view on menopause, and I love that you recognise where we need to go with this. Really great to hear your
I appreciate the opportunity to share it, because I've had a lot of interesting experiences in my life, and this is it's consequence. That's how I am today. That's why I am today, and that's why I do think I think a lot more broadly than most males do, or most anyone does. I've just got a very broad experience, and that allows you to appreciate a lot more. And that's what we've got to start off by appreciating that menopause is not a disease, something women do go through. Every woman's going to go through it differently, and that's where it starts. And from there we start now saying, let's try and understand what it is for you as an individual woman.
Yeah, absolutely agree.
Thanks, David. Thanks very much. Thanks for the opportunity.
We'll see you again next time, hopefully in future.
Yep, you will.
Thank you.
Okay, bye.